Hello and welcome to From the Floor on our conference channel. As my team and I walked around the exhibit floor at the Health 2022 conference, I realized two things. Many health IT professionals could not make it this year because of travel restrictions, busy schedules, and other reasons. And many excellent healthcare solutions were ready and willing to help propel healthcare forward. So here we are from the floor for you to see what you may have missed. Right. So we try to have short conversations with each of the people in the booth and revealed what their solution was, what kind of problem they were trying to solve in healthcare, and the subsequent solutions to those problems. So we hope you enjoy this new series. We're trying it out at the health conference. If it works out, we will continue to do it into next year. Special thanks to our conference sponsors, Sirius Healthcare, VMware, Transcarent, Press Ganey, Sempris, and Veritas for choosing to invest in our mission to develop the next generation of health leaders. And now to the floor.
My name is Erik Wagner. I'm the global lead of healthcare here at Twilio, the Twilio segment. So we are a communications platform as a service, but also have built software on top of our platform of communications to create better patient engagement.
And what is the problem you're trying to solve in healthcare?
So patient engagement, whether that's patient engagement, member engagement, or consumer engagement, right? So whether that's med device, payer, pharma, of course, provider, getting in touch with and staying in touch with the patients, the family, the care teams, and doing that at the right time on the right channel, preferred channel of that patient is really paramount.
And who would you like to speak to at a health system, and what is the conversation you'd like to have with them?
It varies from place to place, right? But generally innovation officers, CIOs, CTOs, and even COOs. But the idea is, again, as a technology company, of course, we're going to work closely with IT. We want to fit into the ecosystem. We, of course, understand the EHR is the center of the universe, as it should be. But there's hundreds, if not thousands, of other ancillary systems that support. So being able to unify and help unify that data to, again, now drive what I've been calling ultra-personalized engagement across a journey is really what Segment can bring with a customer data platform.
Awesome. And are there any use cases you'd like to share?
Sure. So we had a customer on stage yesterday called Health First out of the Northeast. They're a payer. They've been utilizing Segment for some time now, I think about 2 years. And with our announcement of being HIPAA eligible, that was the big announcement yesterday, really unlocks a lot of data. But what they're able to do with their use cases, just as an example, is they serve the underprivileged and work with Medicaid patients. So the patient goes to the pharmacy, or the pharmacist, I should say, tells the patient that their medication, the prescription's been denied. They can actually report back through the Segment data platform, realize that the denial happened, understand why the denial happened, and report real time either with a phone call or a text message to that patient to say, you should ask for the generic drug, not the name brand, because this is why it was denied. We can do this in real time, and we can then also use that data and report back to the physician office to say, you're supposed to always prescribe the right medication, right? So you can work both sides of the coin. You can solve the problem in real time, and then you've got the data point to go back and fix it so that, again, it doesn't occur in the future.
My name is Erik Denna. I work with Health Catalyst. We are a healthcare analytics and transformation company. So we ingest data from lots of different sources, EHRs, financial systems, patient experience, whatever the data are. We integrate those, and then we provide a platform that allows people to do analytics work on that. We also have a professional services arm where we work with clients to help them build analytic applications. We do education around analytic and improvement literacy. We also do tech-enabled managed services where we actually take over functions in behalf of the client and do that work. So it's fairly big, and we've been doing it now for about 13 years.
So what is the problem you're trying to solve in healthcare?
We are all about transformation and improvement work. That's why we do the analytics, is really to support identification of opportunities to improve, and then helping the client work through those improvement opportunities and sustain those gains. So we work with everything from Stanford Health to University of Michigan to Mass General. So tend to be large integrated delivery networks, and we just help them identify opportunities for improvement and make those improvements.
Who at a health system do you want to have a conversation with, and what do you want to talk to them about?
Ideally, we love to work with the chief medical officer, the chief financial officer, and the chief operating officer together, because each of them have a perspective on the improvement. So if we can ideally work with them, because most problems span all three of those areas. And so while we have a technology platform, ideally we really like to have the CIO engaged with those three executives. Again, identifying opportunities, designing interventions, and sustaining those improvements.
Are there any use cases you'd like to share?
We have 300 plus on our website, so I'd invite people to go look. But so Allina Health, we helped them design an intervention for identifying people with congestive heart failure, and then design interventions to detect that sooner, to intervene in the care sooner, and ended up reducing the number of readmissions, actually saving them money, and improving their revenue around cardiac care. So we have, like I said, 300 different cases along those lines.
Well, you've been around for, what did you say, 13 years? You
Yeah.
probably have a few.
Yeah, we have a few.
Awesome. Thank you so much.
My pleasure.
Hi, I'm Leah Sims. I am the Marketing Strategy Lead for Verizon's Healthcare and Life Sciences practice. Excited to share we actually announced today, press release just went out this morning, a partnership that Verizon has entered into with Higgy, managed care, connected care or organization with a really great model for care management. We are an enabler of that solution with connectivity and data security, and our BlueJeans telehealth platform. Many of you may know we acquired BlueJeans about 3 years ago, heading into the pandemic, acquired that video collaboration platform for the purpose of helping our customers and their employees move to home to be able to continue their collaboration. Over the next 6 months to a year, we built an iteration of BlueJeans called BlueJeans Telehealth, a very robust telehealth with all the bells and whistles. We're super proud of that. We offer that direct to providers, but some of the things we're most excited about is how we're integrating that into platforms like Higgy. So patients who have care access challenges will be able to receive virtual care through Higgy kiosk models like this one. And the video collaboration piece will enable those patients to meet with a clinician and to have their care management journey begin there or sustain through these models. So we're super excited about that. And of course, we're also out here at Health talking about how we're deploying private 5G, private edge capabilities, network as a service, and enterprise intelligence solutions to support how hospitals are building their hospital of the future. So I would say right now, for our connected hospital of the future conversation, we really want to talk to both IT and security decision makers in hospitals and health systems, and the clinical innovators within those hospital and health systems who are really looking at real-time innovation in the connected patient room of the future, the connected operating room of the future, and the way hospitals are now going to be newly imagined from the ground up with modularity and connectivity in mind. We love talking to both the IT side and the clinical innovation side because we know it takes both of those folks at the table to really decide how that future of evolved, advanced, interventional acute care really needs to look like.
So my name is Deborah Jordan. I go by DJ, and I'm the Director of Design Thinking with the HTech Collaborative from AARP. So my team works with our startup community, some industries that are involved in this, all the enterprises. Again, they're just trying to help accelerate innovation using a patient-centered design approach to innovation.
And what is the problem you're trying to solve in healthcare?
Well, the larger problem that the collaborative is trying to solve is really around making aging easier. It is inevitable. We know people are living longer, and we want them to live well. AARP's mission is to empower people to choose how they live as they age. So the problems we solve in healthcare, they're broad and vast because there's so many. But fundamentally, we want to make it easier, more manageable, less burdensome, so that people can really enjoy living and thrive as they age.
Awesome. And how are you guys working with health systems?
We actually are working with a number of players in the health ecosystem. How we would work with health ecosystems is, as part of the HTech Collaborative, we've got startups, investors, test beds, and enterprises. And that's where I think the health systems would come into play. Those that want to access our startups or access the technology associated with our startups, do test beds, run pilots with our startups. That's how we would connect and play with health players.
Are there any use cases you'd like to highlight?
For example, we have a continuing care retirement community that is one of our test beds. Baltimore, Washington area. So there we have been able to successfully do pilots with a number of our startups and then look and collect the data on the back end so that we've got some clinical data to support the rationale for making the investments in some of our startups.
What a great group of healthcare partners. We want to thank them for spending some time with us on the floor and sharing their aspirations, their solutions for healthcare IT. I want to thank them for talking to me and talking to Holly and talking to our team on the floor. We also want to thank our conference sponsors who are investing in our mission to develop the next generation of health leaders. They are Sirius Healthcare, a CDW company, VMware, Transcarent, Press Ganey, Sempris, and Veritas. Thanks for listening. That's all for now.